Hi everyone, it's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. I'm here to answer all your questions about skin, health, beauty, and wellness, and take you behind the scenes of my practice. If you have any questions you want me to answer, send me a DM on Instagram at Skin by Dr. Azi, and I'll be sure to answer them on the show. Now, let's get started. Happy spring, everyone. Welcome back. I'm Dr. Azi Shirazi, a board-certified dermatologist, and I'm here today with Nurse Lacie.
Hey, everyone.
How's it going?
I sound like I have a frog in my throat.
Do you?
No,
Should we check?
How are you?
Good. I'm so excited to answer your DMs on today's episode because you guys always have such good questions. And a lot of times you'll ask me things and I'll have to look it up because it makes me learn, right? Because I'm like, oh, what is this? This CO2. Well, there's this,
she knows everything. No. Don't let her fool
you.
What
is the new CO2 laser, people? The cool
tone or
cool
something.
Tone
the cool
or
sculpt
cool laser or something, Sometimes they're just marketing. And I'm like, oh, that's what it is. And
yes.
So I have to look up like, what is this device that you guys are hearing about? But anyway, I do enjoy hearing from you and I love answering your questions. Thank you guys so much for your listenership and subscriptionship. If you haven't subscribed to us yet, hit that subscribe button and share this with a friend because sharing is caring. And it's because of you guys that we're back doing the podcast.
Yes.
And well, let's start with the beauty and blemish. For those of you
we can't miss that.
Yes. For those of you who may not know, beauty is, we talk about the best things that are happening in our life, and our blemishes are things that we could just take a little concealer and just erase out of our life. So why don't you start? Tell us about your beauty and your blemish. Beauty or blemish, I should say.
We'll start with my blemish.
Okay, that was a big pause there.
A big pause. Okay. As a medical office, we see patients back to back, and we do have a schedule for a reason. And we have a pretty good grace period if patients are running late. And I would say we do amazing with getting patients in, even if they're late. We try our best to work them into the schedule. And the other day, we had a patient that was 40 minutes late, didn't do their online check-in, so still had to check in and do their new patient registration, didn't have an ID with them. It was like checking every box on complicated. But we did our best to work them in, and I feel like most practices aren't as good as working patients in like ours. So I would say my blemish is they still weren't happy at the end of the day that we took too long getting them in a timely manner. But my beauty is our team. Our team handled in every which way, front office, back office. Everyone just strives so well for patient care. And I'm truly proud of our team.
I love that about our practice because I feel like the patient customer is always, the priority. And
always the priority.
We do our best, but you're right. Sometimes I don't think patients realize the schedule and accommodating them can be challenging because then that means that we have to, push everyone else's appointment back. But, nevertheless, I'm sometimes one that I'll get stuck on a laser that's more challenging. So I have to take more time, for that. Yeah. And I will never compromise patient care for the sake of running on time. I mean, you know that.
Yes.
Where I might be an hour behind, but it is what it is. And I love the patients that understand that. They're like, if that was me, I wouldn't want you to rush through just so you can see the next patient.
Right.
So it is hard. It's hard to run a procedure-based office.
Yes.
Because sometimes procedures take time. Sometimes procedures take less time. It's hard to predict. And sometimes there's cases that come up and, we have to talk to another doctor or talk to the patient. It's an urgent matter or work people in for urgent things.
Yes.
So, we do appreciate the ones that are understanding.
Yes.
But
so that was my beauty and blemish together. We do our best. And, sometimes at the end of the day, there's going to be people that you just can't, you're not going to make them happy no matter what you did, working somebody in that's 40 minutes late, technically an hour by the time they were done with everything, and still accommodating them.
Yeah,
You do the best
true.
you can, and that's all you can
yeah,
do.
That's true.
How
Well,
about you?
mine is I have a 16-year-old daughter who's driving now.
Oh my gosh, that's a blemish.
It's a beauty and a blemish because it is quite nerve-wracking.
Yeah.
She doesn't have her license yet, so we're practicing. And of course, I'm the one that's practicing with her. So she drives us to school every morning. I have some scratches on my car as a result.
Oh my gosh.
It's like, okay, be careful of that turn,
That
slow
pull.
down. And she's like, Mom, you're stressing me out. So it's like this very
Learning. Yeah.
stressful event every morning trying to
Oh
get
my
to school.
goodness.
But she's getting better. She's getting better. And, it's a beauty in a sense that I spend so much of my time driving Miss Daisy around, which I love because that's the time you get in the car with your kids,
Yeah.
right? They can't really do anything else. They're not
They're
on the
forced.
phone with their friends, and
Forced
they're
one-on-one.
forced in this vehicle with you. And I have a rule where nobody's allowed to be on their phone in the car. And so they're not allowed to be texting their friends or being on Snapchat. So it
That's
is
good.
time, together, but at the same time, it's very nerve-wracking.
Especially if you're not the one driving.
I have to dye my hair more often now. I'm beefing up my retinol percentages. Getting a few more wrinkles.
Aww.
No, but it's all good. It's all part of the journey of having children.
And they really say, you hear it your whole life. You hear it from everyone. Time goes by fast. Having kids, they grow up so fast. But it isn't until you actually have a child that you really, truly understand how fast that goes. I cannot believe
it does.
I cannot believe she's 16.
Everyone scared me so much about the teenage years. Oh, it's going to be like, oh, good luck. Oh, you got a girl, But like any other stage, there's wonderful things about it and there's scary things about it, like driving with a 16-year-old.
I have a 4-year-old who had her first 2 kisses at school the other day.
Wow, she's very precocious.
She's 4 going on 14. Yeah, it's
all right. Starting young.
I see my teenage years ahead of me.
So let's get started on answering your DMs. You have,
all right.
Let's see what you guys are asking us. If you're not following us on Instagram, check out More Than a Pretty Face podcast. You can also follow Lacie and I. If you don't have Instagram, God's favorite, good for you. But you can still send in questions through our email, morethanaprettyfacepodcast@gmail.com.
All right. The first question is from Adrian. I've been using nipple cream for the breastfeeding mamas to hydrate. I can't find a lip balm with lanolin in it. Is the nipple cream okay to use on my lips frequently?
Yes and no. Lanolin is great. It's great for healing. It's great for like cracked, nipples and cracked skin. Mm-hmm. Actually, Aquaphor has lanolin. I was going to say,
is an Aquaphor a good one?
But also, excuse me, lanolin can be a sensitizer.
Yes.
And it can cause an allergic contact dermatitis in a good amount of people. So if you've been using lanolin on your lips and you're noticing the reaction getting worse, you could be having a reaction to the lanolin because some people, like I said, are sensitive to it. The safest thing to use that you're not going to get a reaction to is something like Vaseline, just plain good old Vaseline. What it will do is it will form a seal. It's an occlusive, and that will keep water in your lips, inside your skin, so you don't lose water. But it also forms a protective coating on it, so you're not exposed to, the sensitizers and potential allergens, and it allows your skin or your lips to self-repair. Now, these types of reactions can be tricky because they can be caused by so many different things, like, certain fragrances or dyes. Maybe it's a lip balm that you use with an essential oil in it that caused the reaction. And the funny thing is you won't see the reaction the same day. So you won't see it right after using the product. It's going to be like a day or two later because it is a delayed reaction. And I think that's what's really tough about some of these, dry, peely lips, is a lot of people don't realize maybe it's that lip balm, maybe it's that lip liner. Could it be something like licking your lips all the time?
Right,
And that
licking
can
lips
cause,
is a big one.
because the lips or the skin isn't used to being, going from wet to dry. That breaks down the skin barrier. So my recommendation is to stop the lanolin just in case you're sensitized to it, and just switch to just plain old Vaseline and give that a week. If you're still having issues, again, don't use your lipstick or your lip balms or glosses for a week at least. And if you're still having an issue, then you need an anti-inflammatory to treat the reaction. And you can use something like, I have it right here, Soothe HC. This has an anti-inflammatory medication in it, along with aloe, that helps calm that reaction. In fact, you can put this on and put Vaseline on top. You can do this 2 or 3 times a day for anywhere from a few days to a week, and that should stop the reaction. And then you can reintroduce one thing back at a time, give it a week, because again, it could be delayed. Those are kind of what I would start with. Sometimes you still need to see a dermatologist because it could be even sun damage.
I was just going to ask, could it be sun damage? If maybe she's putting these balms on out in the sun and going out and about her day and actually causing irritation from that too.
Yeah, it could be that. It could be that balm is fine as long as you're not exposed to the sun. But if you expose it to UV rays, it's going to become sensitizing. The other thing is just sun damage can cause dry, peely lips. So actinic keratosis or actinic dermatitis, I'm blanking on the name, actinic dermatitis, particularly on the lower lip. If you're seeing it primarily on the lower lip and you've got these dry, flaky patches, that is a sign of precancers. So you could not be dealing with a reaction, but you could be dealing with precancerous lesions. So it's so important to get evaluated if these little tips and tricks we shared are not cutting it.
Yes. Okay, the next question is from Paulette. She said, firstly, I want to thank you for sharing your wealth of knowledge through all socials. Second, she's curious about what your thoughts are on best way to sleep at night to prevent wrinkles. I've heard it's on your back, but I know so many struggle with this. Any tips or tricks would be great.
I struggle with this. Let's start with me. I struggle with this.
We all struggle with this.
I am such a stomach sleeper.
Oh, I could never.
I'm a huge stuff. I mean, I went like my face in the pillow. It's just terrible.
How do you breathe?
Don't ask. I mean, a lot of people do love that fetal position, which is the worst, not only for your face and your wrinkles, but also like your
chest,
your back, your chest, all of that. Well, the best position really is to sleep on your back. It's so funny. I was talking to my friend about this, and she's like, yeah, I started doing that, but then my butt got flat.
I feel like that would be the issue. Is that not?
As the French say, it's either your face or your butt.
Yeah.
But regardless, sleeping on your back is the best. I mean, not only for your spine, but also your face, because you're, sort of. And my mom is so good about this. She trained herself early on, and she's just, slept on her back. So if you can train yourself to do that, that would be amazing.
Yeah.
They also make these pillows, and I've tried a bunch of them. There is one called Sleep and Glow, which is not bad. It has like a little depression on each side, so that if you do roll over on your side, it takes the pressure off your face, so it puts it on like kind of your head area. And then there's one by Flawless that you can check out, and it has like these prongs. It's like 4 prongs, right? So like stick out, so you're like this, and so if you roll over, those
is it like prongs, a head thing? Like
so it's a pillow on the head, and then it's got these like prongs that stick out of it, and then you can kind of roll over like that.
Maybe I'll show a
video
beauty
of it on. I'll show it on the Instagram for More Than a Pretty Face. I'll link it.
Okay, yes, please.
But yeah, so those can be helpful, and then sleep on a silk pillowcase, because silk is so wonderful at maintaining skin hydration. It also reduces friction and rubbing and tugging and pulling on your skin. So that can be really helpful. It's also great for the hair as well, not just for the skin. So back to the chest wrinkles. which you start noticing. A lot of that is sun damage,
Yes,
but
I know.
you can use
Very
these
well
silicone
aware.
patches I've seen people use where they stick silicone patches on the chest so that it kind of keeps it from scrunching up.
Right.
It works as long as it stays on. If it does have a tape to it, eventually you'll get a rash from the tape.
Yeah, I don't know if it's
But,
worth it.
you know, it's not unreasonable. I think that's a good one to do as well. In terms of what can we do in office, let's say, you know, you already have them, the sleep wrinkles. They go the opposite direction as the expression wrinkles. And there's a great picture. I'll share it on the, well, maybe we'll share it right here of this guy this is Anthony Hopkins, and it shows, you know, his sleep wrinkles versus his natural expression wrinkles. And so what can we do about that? The Botox may not really help those particular wrinkles, but we can use collagen boosting injections. I love this for the chest. It works so well for those vertical lines. It's dilute radius or dilute calcium hydroxyapatite. A lot of times it's abbreviated as CAHA, hyperdilute CAHA. And it's already something that's in your own body. It's in your bones. So you can't be allergic to it. It's a natural thing. And so we inject it into the skin. It's almost like forms like a scaffold. And it stimulates your fibroblasts to form collagen and elastin and helps with kind of plumping up that area and helping with tightening and firming and so forth. We can also do lasers, like the halo laser works really well for both sun damage and those sleep wrinkles. So those are some things that you can do.
What about a sleep mask?
Yeah, so that would work great for around the eyes. In fact, AziMD Skincare has something exciting coming up that is going to help with your beauty sleep and help you with sleep wrinkles. So stay tuned for that. I don't know when this episode is getting released, but look for that early May. Hint, hint.
Hint, hint.
So
our next question's from Josie. She said, "Hi, Dr. Azi and Nurse Lacie. Love your podcast. I lost a little over 40 pounds recently, and at 42 years old, when I look at myself, I feel like I've aged even more. What are some things you recommend that I do to feel better and more youthful?"
Well, first, congratulations.
Congratulations.
I
That's
mean,
a
Josie, that is a lot of
compliment.
weight to lose.
Did you hear me?
What?
I cannot. I said that's a huge compliment.
A compliment.
What am I saying?
Accomplishment. Now, depends, you know, if Josie, how quickly she lost the weight, because that can be a factor.
Yes.
You know, certainly the faster you lose weight, the worse it is for your skin. And then also if she's using Ozempic or some of these injections that so popular right now. And we think there's a metabolic component to that could be, you know, adversely affecting your skin. So, and I'm sorry to hear that, because it can be quite dramatic in terms of the degree of laxity and looseness and things that you might see from the weight loss, because fat is good. We want fat in the face. I mean, if you lose that, then you lose the plumpness, that glow to that area. Well, one thing you can do is take the fat, you know, from the buttock, from the thighs, the stomach, and transplant it, graft it into the face, and that's called a fat transfer.
Yes,
The
but
benefit
not
of that
guaranteed.
is that, you know, you can also get the stem cells from fat, because it does have stem cells. You know, the downside, the risk with that is it's a little bit less predictable. Although if you go to somebody who's really experienced in fat grafting, they're pretty good about knowing how much to put in. But some people hold on to a lot of it, and some people will lose a lot of it.
Yes.
So that's the caveat. I mean, I've seen patients where they'll get the fat grafting, and a year later, boom, it's gone. It like disappeared.
Well, do you remember that one patient? She had it like, it completely went away on one side, and the other side it was still really good.
Yeah, so that's the other downside is, you know, it's a little bit less predictable, and it's invasive, meaning you have to harvest the fat, so you have to suck it out from somewhere, and it could be more costly and so forth. So that's fat grafting, which still could potentially be great. Now, be careful with fat grafting is that if you lose weight and then you regain it, then your face could kind of blow up, because that fat, remember, is like from your buttock or your stomach or your thigh. So that's how it's going to behave.
I didn't think of that part.
So yeah, if you gain weight, then you see people all of a sudden, they just got this big fat, like, you know, almost looks puffy, you know?
Yeah.
And Mickey Rourke is actually a good example of
Yeah.
that.
Okay.
So another option would be to do something like Sculptra, which is volumizer, but it's an injection that was put in. It actually originally it was used for HIV patients
Yes.
that were on antivirals, and it would make them go really gaunt.
Mm-hmm.
That's actually how I trained. I treated thousands of patients at the VA with HIV who we did Sculptra on. That's how I learned Sculptra. So it can help kind of volumize and globally fill in your face. It can be a little bit more predictable. And then fillers, hyaluronic acid based fillers are another option. And you may want to use a combination of both Sculptra and fillers. Fillers for more sort of fine tuning areas of hollowness, and then Sculptra as more of a global volumizer. Now, the benefit of Sculptra is that it can help thicken the skin also, which we don't see with fat. But as we age, especially, into your 40s and your 50s, your skin is going to start to get thinner as a result of your estrogen going down. And so the Sculptra can be really helpful at thickening that skin.
Yes. And a non-cosmetic route, maybe just something at home, just because you said just to feel youthful again. I personally love a really good skincare regimen. I mean, a little bit goes a long way. You just having that routine of just like your self-care every morning and night really will help you feel better too. And after I had my daughter, my two go-to products for like a real game changer in my skincare was the glow serum, the AziMD Skincare glow serum in the morning, and the Lift and Renew at night. And after a couple of weeks of just being on that, I had so many compliments on my skin. So even something as little as that can go a long way if you're not ready for in-office procedures.
And that's a really good point. And I kind of jumped the gun and went to like fat transfer. But a consistent skincare regimen is so, so important. And it can really bring along dramatic changes if you're consistent, if you're using the right product. The Lift and Renew, I love when I use it because it kind of gives my skin this glow.
Yeah.
And it's a retinol, and retinols can help with thickening actually your dermis, and it can help with fine lines and wrinkles, even though it's not going to boost up your fat in the face.
Right.
But it can still really help with texture and help with just the overall quality of your skin.
Yes. Awesome.
So we have one more question. Time for
Yes,
one more question.
Time for
You guys
one more question. Let me find it. Okay, so the next question comes from Jennifer. She responded to our lip filler post, and she said, "My filler only lasts about 2 weeks. I've tried multiple brands. Is this normal?" I'm sorry, lip filler, if I didn't say that.
Okay.
Our lip filler post.
Yeah, we see this from time to time where people either think that their filler isn't lasting, or they complain about it not lasting long enough. So with lip filler, you have to be careful because one, it could be that your filler is not dissolving, but it's actually moving. Yeah. So the filler could be moving out of your lips. And I think one thing that people don't realize is they think that they can take really small lips and blow it up to like Angelina Jolie lips, not realizing that the lip can only hold so much filler. It's like a bag. You can fill it up with a bunch of stuff all the way up to the brim, but then at some point it's going to start to spill over. And so that's what happens with lip filler, especially since it's an area of active movement. So you're talking, you're chewing, you're laughing, you're, using your lips pretty much all day long. And so if you try to overfill the lips, guess what? The filler has to go somewhere.
Yeah.
It can't stay in there. So it's either going to move down, so you see the migration kind of in the lower mucosa area, or you see it moving up into the cutaneous lip, which is the skin above the lips. And as you get more filler that migrates out and goes above the lip, it's going to start to make it heavy. And that heaviness eventually will weigh down on the lip and cause the lip to curve inward. Therefore, you'll see less of your lip because now you've got more filler outside of your lip than you do inside of your lip. And I don't know if that's what she's experiencing. But it could be, because I see it a lot. People think that their filler is that it's dissolving, but it's not.
Yes.
And it's such a scary thing to suggest dissolving because they're like, what? You want to dissolve? Well, I'm telling you, my filler is dissolving too quickly. And you're suggesting that I dissolve my lip filler. And they're just kind of like shocked when I tell them that. But every single time when we dissolve, you can see more of their lip because it's not, that filler isn't hanging down on their lip mucosa anymore. They get that nice curvature, that slope, that scoop or that slope back when we dissolve the filler that is up above the mucosal lip.
Yes. And 2, depending on the size of our lips, I feel like perception drift, right? You go through this huge swelling phase where your lips are like big, and some people love that and some people hate it, but then they go back down to where they should be at, and sometimes patients are like, well, my lips have dissolved now, they're gone.
Yes, because your new normal becomes your baseline, right? So you forget what your lips look like before. That's why pictures are so important.
What about if you want to plump your lips but without filler?
Well, I love the Plump 30. Every time I use it, people are like, you need to stop filling your lips. Your lips are huge, Like, I don't have lip filler. I just put on some Plump. It makes your lips, like, honestly, like you just had a syringe of filler.
But you do yours so well because you don't just do the Plump. You do your outliner, and that's
love
why.
This technique. You do outline your lips with the lip liner. I smear it a little bit, and then I apply the Plump 30, and within a few minutes, honestly, my lips look like I just had a syringe of filler. So, hey, maybe you don't want to keep going in for filler all the time. Try the Plump 30 because it just has a little bit of natural peppermint that helps blood flow and helps, pout up your lips.
But
and it lasts anywhere from, 2 to 4 hours. It's also very hydrating. It's hyaluronic acid, and most importantly, it has SPF in it because a lot of people don't realize that UV damage can degrade your collagen and make your lips smaller. So make sure you're always wearing an SPF when you're in the sun so that it's not causing that collagen degradation, because that shininess to your lip balms, that's like magnifying the UV rays. It's like laying out with baby oil. So I love that the Plump has SPF in it to protect your pout.
Yes.
Love it. Always an option, guys.
This was such a good episode.
Yes, you guys had so many great questions. Thank you so much for joining. And again, your listenership and subscriptionship is so important.
Yes.
It's the reason we keep the podcast going. Until next time, bye guys.
Bye.